Good afternoon, everybody. It's David Porter, LADC, and I'm here today to talk about treatment of opiate dependence using MAT, medication assisted therapy. There are several options available for medication assisted therapy for opiate dependence. Uh, the oldest treatment is going to be methadone. Now, methadone use is controversial. Methadone is a strong opiate agonist, same as heroin, same as morphine, and it is used as a replacement drug or agonist therapy for people addicted to heroin. Instead of the person acquiring an illegal drug and injecting it with a dirty needle, possibly spreading HIV or AIDS or risking overdose, the person will receive an oral medication. Methadone is typically administered orally, and it is going to be prescribed by a physician. Therefore, it is legal for the person to use it. And typically, at most methadone clinics, when someone can earn the privilege of what are called take homes, where they can take a small dose home with them. Basically they're being trusted with it, that they're not going to divert it or abuse it. Divert it meaning sell it to other people for a profit. Uh, I have many concerns and reservations about methadone, and methadone treatment has become controversial. It's probably always been controversial. There are many people who say that it is just getting people addicted to a different drug, and methadone is addictive. Methadone is a strong opiate, and you can become dependent on it, and you can overdose on it, especially when it's mixed with other drugs. I also have concerns about methadone because it has multiple long term health effects. It is very bad for your teeth. It causes severe dental caries or dental decay. It can precipitate adult onset diabetes. And in men, of course, it reduces testosterone levels, which will lead to a host of other health problems. So I have concerns and reservations about use of methadone. I really don't think it should be employed unless someone has had multiple treatment failures. In other words, if someone has tried a number of other measures and it has not been successful, and if methadone is the only thing that will give them quality of life and keep them clean and sober, then clearly a cost benefit analysis has to be done. But I don't think it should be the first line treatment. Something which is more recent, meaning 2003, it's been in use in the United States since 2003, is buprenorphine. Buprenorphine, when mixed with another drug called naltrexone, naloxone, is going to be called Suboxone. And then you have straight buprenorphine under the brand name Subutex. And here's how buprenorphine is different from methadone. Buprenorphine is a weak opiate agonist when taken orally versus a strong opiate agonist like methadone is when taken orally. The buprenorphine medication is a pill which is either put under the tongue or a strip which is put under the tongue. It's taken by the sublingual route. It dissolves in the saliva and is absorbed by the blood vessels in the oral cavity. And it's going to be a weak opiate when it's absorbed that way, meaning it's going to go to the opiate receptors in your brain, same place that heroin and Oxycontin and methadone attach to, but it's not going to grab a hold of them really strong, so to speak. It's going to be a light touch, just enough so your brain knows it's there, and this sends a message to the pleasure centers of your brain that, hey, we have opiates here, we don't need more. And it diminishes cravings. For a lot of people, it completely shuts off cravings. Um, but that naloxone is standing by. First, it is going to be weakly absorbed when taken sublingually, but if someone tries to abuse their buprenorphine by crushing the pill and snorting it, crushing it, mixing it with water and shooting it, because once it's shot or injected, it works as a strong opiate and gets you high. but not with a naloxone in there. Naloxone is poorly absorbed orally, very, very well absorbed when snorted or injected. So that's going to yank the opiates right off those receptors, rip them right off the receptors, make you good and sick. So that should dissuade people from abusing it again. Or if it doesn't have that dramatic an effect, putting someone into immediate withdrawal, what it's going to do is nothing. It's not going to get you high. It's going to be like shooting up saline. There's not going to be any reward. So buprenorphine, either as Suboxone or Subutex, is a these are good drugs. I've seen really good results, and it's made a major improvements in quality of life for many heroin addicts. So totally support the use of buprenorphine, and it does not get you high. Yes, when people first start using buprenorphine until their body adapts to it, they're going to get a little bit of euphoria, but it's not going to be that pronounced, and that goes away. Buprenorphine is very safe. It's hard to overdose on, though it can be done. It's hard to overdose on it. And if you take too much of it, you're going to get severe motion sickness, which is not going to be pleasant. So that tends to dissuade people from trying to overdose on it, trying to abuse it. However, it does have a very big street value because there are a lot of people who want the relief that buprenorphine gives without the obligation, commitment, responsibility that goes along with being part of a treatment program. So they buy it on the street and just take it illicitly. So that's a problem. There's no medication that's perfect. Now, two other options. I mentioned naloxone. There is a oral form of naloxone called naltrexone, and people take this and it blocks opiates so that if you use opiates, you don't get high, and you know there's not going to be a reward. Your desire for opiates diminishes. A lot of people report that just taking naltrexone reduces their cravings for opiates over time. Naltrexone can be used very well after someone's been on buprenorphine for a year or two, or maybe 5 years, and they're ready to come off the buprenorphine. They take the naltrexone indefinitely, and it's a little bit of insurance, a little bit of a buffer, security that helps them stay clean and sober as part of a comprehensive treatment program. And then there's Vivitrol. Vivitrol is an injectable form of naloxone, which is going to be slowly absorbed by your body and released over a few weeks. You get this injection once a month, and it works the same as the oral medication, where it blocks opiate receptors and reduces cravings. So you have buprenorphine as either Suboxone or Subutex. You have Methadone, you have Naltrexone, and you have Vivitrol. These are four promising options, or I should say three promising options. One I have a lot of reservations about for the management of opiate addiction. So, thank you for watching, and please check out my other videos on this channel about addiction. Please hit subscribe. I intend to put up a lot more videos on, whoops, sorry about that, just shook the camera. I intend to put up a lot more videos on addiction, addiction treatment, mental health, and forensic psychology. So please hit subscribe, and give me suggestions for topics. If there's any topics that you'd like to hear about, write it in the comment section, and I will see about making a video on that topic. So everyone, be safe. Thank you for watching. And let's shut down the webcam on 3, 2, 1.